Good day, Mom. So today I'm going to present about the research in health behavior of adolescents, including smoking, drinking alcohol, drug use, sexual intimacy, and violence. So first in the research is the gap of the study. The gap of the study, only a few students on the moderating effect of adolescent behaviors have derived additional meaningful results from the study of adolescent sexual experience. In this study, it is not possible to control for various variables that can impact adolescent sexual experience. Example is the peer influence parental monitoring should be researched in the future. The second one, it is about the research questions. So first is the sexual intercourse. The question is, have you ever had sex? So in sexual intercourse was measured by answering to the question, which the participants could respond either yes or no. Second is the drinking, smoking, and drug use. The question, what are there any drugs or substances that you have habitually used so far, aside from those for therapeutic purposes? Drinking was the participants could answer if the drink was classified as yes if the participant had drunk more than one alcoholic beverage in the previous 30 days and no if they had never consumed alcohol or had not drunk more than one alcoholic beverage in the past 30 days. Smoking was classified as yes if the participant smoked even one cigarette in the last 30 days or multiple days in a month, and as no if they had never smoked before or had smoked only one cigarette in the last 30 days. Cigarettes included all types of cigarettes, for example, liquid e-cigarettes and vapor e-cigarettes. And lastly, for drug use behavior, the raw data were used as they included the no and yes responses to the question. The third is the participant characteristics. The question in the participant characteristics is how was the academic performance been in the last 12 months? And what is the economic status of your household? So based on Kim, in the owner of the research, the participants were asked to provide their gender, school type, my father's educational level, mother's educational level, and academic performance. Gender was divided into men and women, and school type was divided into middle school and high school. Based on Pio et al., the previous study was educational levels of the father and mothers were reclassified as high school graduate or lower, or university graduate or higher. Other and refusal to respond. For academic performance, high and the high middle were classified as high, low middle, and low as possible responses to the question. The family and school characteristic, economic status, residence, status living with or without parents, and the school type were also considered. Based on previous studies, economic status was legitimized. High, high middle, and middle were classified as high and low middle, and low were classified as low in the response to the question of base of the question were classified cohabitation with parents, asked if participants were currently living with at least one of their parents. The school types were divided into all girls and all boys. The next part it is about the significance of the study. So this study investigated the association between the adolescent health behaviors in drinking, smoking, and drug use, and sexual intercourse, as well as the moderating effects of economic status, cohabitation with parents, and school type among adolescents. Adolescents' unhealthy behaviors such as the drinking, smoking, and drug use were found to be associated with a high percentage of sexual intercourse, and effect was moderated by economic level and school type in association between drinking and sexual intercourse. Therefore, the therefore to efficiently reduce the risk of sexual experiences, programs the programs catered for adolescents should focus on healthy lifestyle interventions. And in addition to the significance of the study, for those who habitually drink, customized sex education should be provided according to the school type and economic status. Next is about the result of the study in the research. So first is the participant characteristic and sexual intercourse. So in the result of the study, in total, 54,948 students participated in the 2020 survey. In the result, in men, we have the 51.9%, and to the woman, we have 48.1%. Approximately 49.6% were in middle school and 50.4% were in high school. Regarding the further educational level, 42.9% had the highest level of education with the college degree or higher. Likewise, 41.8% of the mothers had the college degree or higher. However, 22.3% of the respondents refused to answer questions about their family members. Regarding academic performance, 67.0% and 33.0% reported high and low grades, respectively. Approximately 87.4% reportedly having a high economic status, whereas 12.6% stated that it was low. In addition to this result of the study, 76.3% live with their parents and 1.4% did not. So regarding to the school type, the majority attended co-ed institutions 66.5%, followed by all boys in schools have 17.3%, and all girls schools 16.2%. So in terms of health behaviors, 10.7% engage in the habitual drinking, 4.8% smoke, and 0.8% the habitually use drugs, including to those for therapeutic purposes. So we have the total of 4.6% of the adolescents have sexual experiences. Results of the study, we have here a table of the results of the study. So in this table, we have the differences of sexual intercourse by the characteristics. So characteristics, categories, total, yes, and also no. So those who responded yes and also to no. So the characteristics, we have the gender, school grade, father educational level, mother's educational level, academic achievement, economic status, cohabitation with parent, school type, drinking, smoking, drug use. So we have the categories in drinking. To those who answered yes, we have the total of 5,000. In drinking, we have the 5,892. Or if we convert into a percent, we have 10.7%. It is the total of to those who drink. And to those who answered yes, we have 1,123. If we convert into a percent, we have 19.4 to those who answered yes. And to those who answered no, we have 4,769. If we convert it into percent, we have 80.6. In category of no, we have the total of 49,056. If it convert into a percent, it has a 89.3. Those who answered yes with the total of 1,364, and it convert into percent, a total of 2.8 to those who answered yes. And to those who answered no, we have 47,692. If it convert into percent, it has 97.2 to those who answered no. In the characteristic of smoking, so we have the category of yes. So to those who answered yes, it has 2,688 total. If it convert into percent, it has 4.8. So to those who answered yes in smoking, it has 928, and if convert into percent, it has 35.2 to those who answered yes in smoking. And to those who answered no in smoking, it has 1,760, and it convert into percent, it has 64.8. Next category is the no. We have the total of 52,260. If it can convert into percent, it has 95.2 total. So to those who answered yes, it has 1,559. If it convert into percent, it's 3.0 to those who answered yes. And to those who answered no, we have 50,701, and it convert into a percent, we have 97.0% to those who answered the no. So the next is about the drug use. In category of yes, we have the total of 405. Convert into percent, it has 0.8%. And to those who answered yes, we have 82 result, and 20.1 if we convert it into a percent to those who answered the yes, and 323 total, and if it convert into a percent, it has 7.9%, 79.9% to those who answered no. So in the category of no, the total we have 54,543. If we convert into a percent, a total of 99.2%. So to those who answered yes, it has 2,405, and if we convert into percent, 4.4%. To those who answered yes. And to those who answered no, we have the 52,138. If you convert into the percent, it has 9.5% to those who answered no. The next is the differences in the sexual intercourse according to participants' characteristic and the health behaviors. The sexual intercourse rate was 5.8% for male adolescents, which was higher than their female counterparts, the 3.3%, and it was 7.3% for high school students, which was higher than that for middle school students, 1.8%. The rate of sexual experience was relatively high when the father had a lower and high educational level or when the participant refused to respond. Similar results were found for mothers' educational levels. With low intermediate academic achievement accounted for 6.3%, compared to those with intermediate high grades or higher, 3.7%. The rate of sexual experience was higher in those with economic status of middle or lower, 7.1%, that in those with academic or high income, 4.2%. With the rate of 11.8%, and for those who did not live with their parents, which was significantly higher than that for those who live with their parents, we have 3.9%. The sexual experience rate for students in all boys' schools was 6.8%, which was relatively higher than those attending all girls and co-ed, all girls at 3.5% and co-ed 4.2% in schools. The sexual experience rate of adolescents who habitually drank alcohol was 19.4%, which was very high compared with that no drinkers, that it has 2.8%. The sexual intercourse rate for those who habitually smoke was 35.2%, significantly higher compared to those non-smokers have the 3.0%. The sexual intercourse rate of adolescents who habitually use drugs was 20.1%, significantly higher than that than of the non-drug users, have 4.4%. That is based on the table 1 that I showed earlier. Next is main and moderating effects. In table 2, it represents the main, the models 1 and 2, and moderating in model 3 effects. So in model 1 was statistically significant for gender, school grade, drinking, smoking, and drug use. The explanatory power of the model was 19.6%. The risk of sexual experience was 1.4 times higher among male than female adolescents. That 95% confidence interval, and 2.69 times higher among high school students than among middle school students. 95%, that it was 3.18 times higher among habitual drinkers, have the 95%, than among non-drinkers. The habitual smokers were 6.77 times more likely to have sexual experience than non-smokers. Meanwhile, the habitual drug users' sexual intercourse rate was 3.24 times higher than that of the non-drug users. The next is I'm going to show a model of a table 2 of linguistic regression model of sexual intercourse. So in the table in model 2, the control variables of family and school characteristics were added and found to be statistically significant in terms of gender, academic grade, drinking, smoking, drug use, economic status, and cohabitation with parents. The explanatory power of the model was 19.9%, which increased the significant by 0.3% compared with the model 1. The risk of sexual experience was 1.25 times higher for those with a low intermediate economic status than for those with the intermediate, high grades, or high economic status. Moreover, it was 2.44 times higher among students who did not live with their parents or refuses to respond than when at least one of their parents live with them. However, school type was not significant. In the Model 3, it shows the result of the examination of the moderating effects of the economic status, cohabitation with the parents, and school type and type on the association between drinking, smoking, drug use, and sexual intercourse. This was found to be statistically significant for the following interaction terms in drinking and drinking in drinking. And the explanatory power of the model was 20.0%, demonstrating the significance of 0.1% increase compared with that of the Model 2. The risk of sexual experience was 0.71 times lower when habitual drinking was compared with the low economic status. For students of co-educational institutions and all-girls school who drank habitually, the risk of the sexual experience was 9.29 times and 1.62 times higher than that of the students attending all boys schools respectively. For this presentation, here's the last part. Here's a question. As a concerned citizen, what are your proposed solutions and recommendations to teens to avoid getting into such risky behavior? My answer is, as a concerned citizen, a solution that I propose is that the teens should have a knowledge of what would be the consequences if ever they will involve this kind of behavior. And also to the adults should teach, share, and also show as a good example to teens not to engage this behavior. And additionally, to the things they have any freedom to do and decide what they want, but with limitations, of course. And to the adults should be responsible to look and give attention and also to guide the teens that it is also for their own good. The teens should listen and also follow to the adults what advices will be given to them, and to explain to them as well as of what will be the possibilities might happen if ever they don't listen and follow the advices in engaging in this kind of behavior. So my recommendation is that the teens should ask advices as well as guidance to the adults or who are younger to them. So that, and also it is better idea to attend some seminars that can help them in gaining knowledge about risky behavior or in the health behavior of adolescents, that including about smoking, drinking alcohol, drug use, sexual intimacy, and violence. And that's all for this presentation, ma'am. Have a good day. Thank you.